What is magnesium and what is it for? Magnesium is a mineral that is important for normal bone structure in the body. People get magnesium from their diet, but sometimes magnesium supplements are needed if magnesium levels are too low. Dietary intake of magnesium may be low, particularly among women. Magnesium deficiency is also not uncommon among African Americans and the elderly. Low magnesium levels in the body have been linked to diseases such as osteoporosis, high blood pressure, clogged arteries, hereditary heart disease, diabetes, and stroke. An easy way to remember foods that are good magnesium sources is to think fiber. Foods that are high in fiber are generally high in magnesium. Dietary sources of magnesium include legumes, whole grains, vegetables, especially broccoli, squash, and green leafy vegetables, seeds, and nuts, especially almonds. Other sources include dairy products, meats, chocolate, and coffee. Water with a high mineral content, or hard water, is also a source of magnesium. Magnesium is most commonly used for constipation, as an antacid for heartburn, for low magnesium levels, for pregnancy complications called preeclampsia and eclampsia, and for a certain type of irregular heartbeat, torsades de pointes. How does it work? Magnesium is required for the proper growth and maintenance of bones. Magnesium is also required for the proper function of nerves, muscles, and many other parts of the body. In the stomach, magnesium helps neutralize stomach acid and moves stools through the intestine. Effective for constipation. Taking magnesium by mouth is helpful as a laxative for constipation and to prepare the bowel for medical procedures. Indigestion, dyspepsia. Taking magnesium by mouth as an antacid reduces symptoms of heartburn and indigestion. Various magnesium compounds can be used, but magnesium hydroxide seems to work the fastest. Seizures in women with preeclampsia. Administering magnesium intravenously, by IV or as a shot is considered the treatment of choice for eclampsia. Administering magnesium reduces the risk of seizures in women with this condition. Low levels of magnesium in the blood, hypomagnesemia. Taking magnesium is helpful for treating and preventing magnesium deficiency. Magnesium deficiency usually occurs when people have liver disorders, heart failure, vomiting or diarrhea, kidney dysfunction, and other conditions. A pregnancy complication marked by high blood pressure and protein in the urine, preeclampsia. Administering magnesium intravenously, by IV or as a shot is considered the treatment of choice for preventing seizures in women with preeclampsia. Likely effective for a type of irregular heartbeat, torsades de pointes. Giving magnesium intravenously, by IV, is helpful for treating a certain type of irregular heartbeat called torsades de pointes. Possibly effective for irregular heartbeat, arrhythmias. Giving magnesium intravenously, by IV or by mouth seems to be helpful for treating irregular heartbeat, also called arrhythmias. It is not yet clear whether magnesium helps reduce irregular heartbeat after heart surgery. Asthma. Giving magnesium intravenously, by IV, seems to help treat sudden asthma attacks. However, it might be more beneficial in children than in adults. Taking magnesium using an inhaler might improve breathing in people with asthma, especially when used with the drug salbutamol. But conflicting results exist. Taking magnesium by mouth does not seem to improve attacks in people with long-term asthma. Nerve pain in people with cancer. Giving magnesium intravenously, by IV, seems to relieve pain caused by nerve damage due to cancer for several hours. Cerebral palsy. The best evidence to date shows that giving magnesium to pregnant women before preterm births can reduce the risk of cerebral palsy in the infant. Chronic fatigue syndrome, CFS. Administering magnesium as a shot seems to improve symptoms of fatigue. However, there is some controversy about its benefits. A lung disease that makes it harder to breathe, chronic obstructive pulmonary disease or COPD. Administering magnesium intravenously, by IV, seems to help sudden COPD symptoms. Also, taking magnesium using an inhaler, along with the drug salbutamol, seems to reduce sudden COPD symptoms better than salbutamol alone. Cluster headache. Giving magnesium intravenously, by IV, seems to relieve cluster headaches. Colon cancer, rectal cancer. Research shows that eating more foods with magnesium in them is linked to a reduced risk of colon and rectal cancer. But other research suggests that magnesium might reduce colon cancer risk, but not rectal cancer risk. Heart disease. Taking magnesium by mouth seems to reduce chest pain attacks and blood clots in people with heart disease. Cystic fibrosis. Research shows that taking magnesium by mouth daily for 8 weeks improves lung strength in children with cystic fibrosis. Diabetes. Eating a diet with more magnesium is linked with a reduced risk of developing diabetes in adults and overweight children. Research on the effects of magnesium for people with existing type 2 diabetes shows conflicting results. In people with type 1 diabetes, magnesium might slow the development of nerve problems caused by diabetes. In women with diabetes in pregnancy, taking magnesium seems to improve sensitivity to insulin and reduce the levels of sugar in the blood. Fibromyalgia. Taking magnesium with malic acid, super malic tablets, by mouth seems to reduce pain related to fibromyalgia. Taking magnesium citrate daily for 8 weeks seems to improve some symptoms of fibromyalgia. Hearing loss. Taking magnesium by mouth seems to prevent hearing loss in people exposed to loud noise. Also, taking magnesium seems to improve hearing loss in people with sudden hearing loss not related to loud noise. Injecting magnesium by IV might also help improve sudden hearing loss. High cholesterol. Taking magnesium chloride and magnesium oxide appears to slightly decrease low-density lipoprotein (LDL) or bad and total cholesterol levels, and slightly increase in high-density lipoprotein (HDL) or good cholesterol levels in people with high cholesterol. There is also some evidence that magnesium might lower blood fats called triglycerides in people with high triglyceride levels. A grouping of symptoms that increase the risk of diabetes, heart disease, and stroke, metabolic syndrome. People with low magnesium levels are 6 to 7 times more likely to have metabolic syndrome than people with normal magnesium levels. Higher magnesium intake from diet and supplements is linked with a lower risk of developing metabolic syndrome in healthy women and healthy young adults. A disease of heart valves, mitral valve prolapse. Taking magnesium by mouth seems to reduce symptoms of mitral valve prolapse in people with low magnesium levels in their blood. Weak and brittle bones, osteoporosis. Taking magnesium by mouth seems to prevent bone loss in older women with osteoporosis. Also, taking estrogen along with magnesium plus calcium and a multivitamin supplement appears to increase bone strength in older women better than estrogen alone. Pain after surgery. When administered with anesthesia or given to people after surgery, magnesium seems to increase the amount of time before pain develops and might decrease the need to use pain relievers after surgery. Giving magnesium intravenously by IV seems to help reduce pain after a surgical procedure to remove the uterus called a hysterectomy. But magnesium does not seem to help reduce pain in children after tonsil removal. Premenstrual syndrome, PMS. Taking magnesium by mouth seems to relieve symptoms of PMS, including mood changes and bloating. Taking magnesium by mouth also seems to prevent premenstrual migraines. Chest pain due to blood vessel spasms, vasospastic angina. Giving magnesium intravenously by IV seems to prevent blood vessel spasms in people with chest pain caused by spasms in the artery that supplies blood to the heart. Possibly ineffective for